This is chapter 18, recorded number 2. So when we're talking about abdominal pain, there are two different types of nerves that actually supply the peritoneum itself. So abdominal pain can have very, very different qualities. The parietal peritoneum is supplied by the same nerves that supply the skin that's over top of the abdomen. So you can perceive pain, touch, pressure, heat, and cold. Pretty easy to identify. You can kind of locate that point of irritation, so that pain is said to be localized. The visceral peritoneum is supplied by the autonomic nervous system. So the nerves are really hard to localize sensations. Patients really can't describe where exactly the pain is. So it's called referred pain. So because of where synapses occur, that's why you get specific signs and symptoms. So the gallbladder here is what's being shown as the irritation. You have pain that wraps around all the way to the back, and then also up to that right shoulder as well, because the nerves synapse or come together at those points. So it's really easy for that pain signal to spread out. Common causes of acute abdomen ulcers. So what happens with ulcers is that the protective layer of the mucus erodes, and so acid actually can get to the organ tissue to eat it away. So to keep your stomach safe, it lines itself with mucus. And if that goes away, now all of a sudden that highly acidic substance is able to get to the tissue and destroy it. There's a couple of different causes of peptic ulcers, peptic meaning in the stomach. H. pylori infection is just a specific type of infection. There's also the chronic use of NSAIDs, or non-steroidal anti-inflammatory drugs. So this would include Motrin, ibuprofen, stuff like that. And then alcohol and smoking also does it. If the erosion ulcer itself gets big enough, it can actually lead to gastric bleeding. Peptic ulcers definitely affect men and women equally, but they occur more frequently in the geriatric population. So it's not a men versus women type sex thing. It's an age thing. How they describe this to you, it's typically going to be like a burning, gnawing pain in the stomach that subsides or diminishes immediately after eating, because now all of a sudden that acid is getting soaked up by something other than the tissues. Nausea, vomiting, belching, heartburn, all very common symptoms. Some ulcers heal without intervention. Some have to be put on medication to reduce the amount of acid in the stomach to try and protect and let things heal. Gallstones. So we learned that the gallbladder is that storage area for bile. Excuse me. And then other waste from the liver. Gallstones may form if a blockage that has started there doesn't pass. And it can lead to severe inflammation of the gallbladder, which is called cholecystitis. The pain can be pretty significant. Cholecystitis is when you have a gallbladder stone in which the wall of the gallbladder becomes inflamed, and it can actually rupture in severe cases. How your patient's going to kind of talk about this is it's constant severe pain in the right upper or mid abdominal region, may refer to the right upper back, flank, or shoulder. Symptoms appear about 30 minutes or so after eating a fatty meal, and then at night. Other symptoms include nausea, vomiting, indigestion, bloating, gas, belching, so anything that looks like having problems with getting food through the digestive tract. Some people are at higher risk for developing cholecystitis. Just being a woman ups your chances of having gallstones. Um, older adults, so the geriatric population, obese people, and then people of Scandinavian, Native American, and Hispanic descent, as well as women are extremely prone to gallstones when they're pregnant. So, pregnant woman complaining of upper right quadrant pain that comes on about 30 minutes after she eats, pretty suspicious. Pancreatitis, so this is inflammation of the pancreas. This can be caused by obstructing gallstones, alcohol abuse, and then there are other diseases as well. I will tell you that if the National Registry talks about chronic alcohol use with abdominal pain, they normally point that back to pancreatitis. So keep that in mind. Signs and symptoms: severe pain in the upper left and right quadrants, often radiating to the back. Some patients say that their pain increases after they eat. They tend to have nausea and vomiting, abdominal distension, and tenderness. With this, it can be pretty nasty. So you can actually get sepsis or severe hemorrhage with pancreatitis. Make sure that you look for signs of fever or tachycardia that you wouldn't expect to have. Appendicitis is either inflammation or infection of the appendix itself. This can cause the tissue to die, which can lead to an abscess, peritonitis, and or shock. Pain is usually more generalized, dull, diffuse, starts out centering around the umbilicus, so the belly button. The pain later localizes down to that right lower quadrant, which is where we all kind of think of appendix pain going. Signs and symptoms: nausea and vomiting, anorexia, which in this setting is loss of appetite, fever, chills, and then rebound tenderness. And this is because that peritoneum gets very irritated. So there's a spot on the abdomen called McBurney's Point, and apparently we don't frequently call it that anymore, but that's where I learned it at. But if you press on that spot on the abdomen, press in, yeah, it's going to hurt a little bit, but when you let go and blood rushes back to that area, that's really going to set them going. So instead of the press down being the problem, it's the letting off of pressure. And so that's called rebound tenderness. Gastrointestinal hemorrhage is our next cause of an acute abdomen. This is any sort of bleeding within the GI tract. It can be acute, tends to be shorter term, like they haven't had the pain for an awful long time, but the pain itself tends to be more severe. Or it can be chronic, and you've got this long duration, and the severity is not as bad. So it kind of depends on what's going on. All complaints should be considered serious. This can occur in the upper or lower GI tract. Bleeding in the upper GI tract occurs from the esophagus down to the small intestine. Hematemesis is frequently seen in patients with upper GI bleeding, so throwing up blood. Lower GI bleeding occurs between the upper part of the small intestine and then the anus, often manifests as melena, which is dark, tarry stools, because you have processed all that blood where you're going to do all of your digestion, and then you're going to get rid of it in your stool, and so it tends to turn really dark. Esophagitis. Esophagitis occurs when the lining of the esophagus becomes inflamed by either infection or because of acid from the stomach. So GERD, also known as gastroesophageal reflux disease, is a condition in which that sphincter, that round circular muscle at the top of the stomach, allows stomach acid to move up into the esophagus. It's not supposed to do that, but it sometimes does. We also call this acid reflux disease. It causes a huge burning sensation within the chest called heartburn. Your patient may or may not report pain when swallowing. Other symptoms include heartburn, nausea, vomiting, and then sores in the mouth. If you have enough of that acidy content, that just hangs out in your mouth, it's going to start eroding things. Esophageal varices, this occurs when the amount of pressure within the blood vessels that are around your esophagus, the blood flow to them ends up becoming blocked, and the vessel ends up dilating and causes the capillary network within the esophagus to actually start leaking. If the pressure continues to build, the vessel walls may end up failing, which then causes massive upper GI bleeding and so much blood being thrown up. Initially, your patient's going to show signs of liver disease, so fatigue, weight loss, jaundice, anorexia, edema in the abdomen. And when I'm saying edema in the abdomen, like could look pregnant type of edema. Nausea and vomiting. Gradually, the disease processes or progresses, so it's not like it comes on and it's there. It takes a while to build up to this, and that's even before the patient starts feeling discomfort. So often esophageal varices are far more advanced than we would like to have them, just because they often don't cause a lot of symptoms in the early portions of the disease. Rupture of a varice, far more sudden, far more something that we need to take care of or be aware of. So a sudden onset of discomfort in your throat, severe difficulty swallowing, vomit of bright red blood, hypotension, and signs of shock. Mallory-Weiss syndrome. So you have a junction that's in between your esophagus and your stomach. If this tears because of a number of things, but typically it's going to be somebody that drinks or somebody that has an eating disorder. You can have it just happen without having predispositions, but those two groups of people are more likely to have a Mallory-Weiss syndrome. So this junction between the esophagus and the stomach ends up tearing, which causes severe bleeding and possibly death. It's prevalent in older adults and older children. Vomiting is the principal symptom. In extreme cases, patients may experience signs and symptoms of shock, upper abdominal pain, metaemesis, and melena, but may or may not. Gastroenteritis. This is what we typically think as that common stomach flu. So we call it stomach flu. It's really not. Usually it's gastroenteritis. So this is some sort of infection, typically a virus, combined with diarrhea, nausea, and vomiting. You can have bacterial forms, but the ones that I see more often than not are the viral form. So you just have to let it ride out its course. You can get gastroenteritis from other non-infectious conditions, such as a medication reaction, toxic exposure, chemotherapy. So anytime you start messing with that normal lining or flora within your intestines, you can actually spur this on. Diarrhea is the principal symptom in both types, either bacterial or infectious. Signs and symptoms: large dumping type diarrhea or frequent small liquid stools, diarrhea that contains blood or pus, abdominal cramping, nausea, vomiting, fever, and anorexia. So again, having no appetite. And we will go on in the next video.